Hi, my name is Sarah Ezel, and I am a practicing RN in the state of North Carolina. I work for Carolina's Medical Center on a medical surgical unit. I'm currently participating in a collegiate debate on the House Bill 88, which is the Modernized Nurse Practice Act. During the discussion and investigation of this bill, I found one of the best arguments for passage of the bill is to allow nurse practitioners to practice at the full extent of their scope of practice, which could open the doors for nurse practitioners to provide primary care for people in need. There are currently about 4.5 million people in North Carolina that are without adequate health care. And by allowing nurse practitioners to fill these roles, we could get more health care out to the people that really need it. Um, my best argument against this bill is the lack of clarification of how much education you need to be a nurse practitioner in North Carolina. Currently, you can go and get your master's level degree and be a nurse practitioner, or you can get your doctorate in nursing. And I believe that is a problem with this bill, and we need to make a clarification on what is required to practice without supervision of a physician. This legislation went through the House and went to the Senate in February 14th of 2017, and there's not been any current activity. So it seems it's stalled or is waiting to go through the committee for further review. My stance on this issue is definitely in support of it. I believe that providing care for people by nurse practitioners is equally as safe as a physician, and sometimes our bedside experience can help us make better decisions for the care of our patients. We also need to find a way to get care out to the people that are without health care in their areas and have to travel too far or they can't afford it. And this bill will help provide more primary care providers in those areas. And finally, it was shown that we could save money in North Carolina up to $430 million annually and provide 3,800 jobs, which would help stimulate the economy. Um, the next step, I believe, is a revision of this bill. There's a lot of good aspects, but the education level needs to be clarified. A 2-year master's level degree is not equal to a physician's education, and so I believe a doctorate level degree should be specified in those practices where there's no physician oversight. And also, we need to revisit the roles of our CRNAs and whether they still need an anesthesiologist on staff, because I believe that the teamwork there and the collaboration with an anesthesiologist and the CRNA is beneficial to our patients, and safety wise is beneficial.